Good morning, everybody. I really hope you can hear this music. Otherwise, I look dumb again, just bouncing along to nothing. We're trying this new, some nice, smooth music. Good morning. It is another episode of the Healing Hour. I am your host, Sarah Fargo O'Brien. I am real excited about today's topic, today's guest. We have Susan Frager on, MSW. Masters of Social Work, another one of my social work buddies coming on to talk about something really interesting, definitely for therapists out there. We're talking about medical billing and like a lot of the big conglomerates that you guys know about. Susan has like some awesome insider information on this, and we are all going to learn something today. We are all going to learn something today. I can tell you that. This is wrapping up my month on mental health awareness, and man, there ain't nothing truer than bringing some awareness to the mental health of the people that provide the mental health care and do all the things behind the scenes, including dealing with like crazy insurance. So if you're here, let me know that you're here. Leanna's here. Hi, thank you for joining. Good morning. Leanna, you're gonna learn something. This is gonna be good. Lisa, good to see you. Good morning. Andrew, of course, in the house. Good morning, Andrew. Glad to see you here. Let me do a quick check-in, and then I can bring Susan on. We can do our deep breaths, talk about who she is, what she does, and then we'll dive into today's content. So I am a little less frazzled this morning because I did not have to go anywhere. So just getting up, having a normal slow morning like I like to have, taking my dog for a walk, like getting myself sort of here. I've had 3 more hours to get ready for this than Susan, who is joining us from the West Coast. That's exciting, but early for her today. So y'all be kind. You know, she's not a morning person like me, and God bless her for coming on this show so freaking early from where she's at. I'm going to bring her up. Then we're going to do our 3 deep breaths. And then we will talk about what Susan does and how this absolutely relates to mental health awareness for everyone. Oh, my other buddies in the house. Hi, Jason. Good morning. I'm so happy to see you. We're going to learn something today, buddy. Like, this is going to be good. Okay, so let me manage my screens here. Let me pull this one off. Pull my girl on. Hi, Susan.
Hey, Sarah. Good morning. And
we're here, right? Coffee. Thank
God.
Coffee.
Yes. It is a typical Washington day for those of you raining.
It's been like that here in Virginia, like all week. It's been like 60 to 62 degrees and raining. It's real weird for the end of May here. That's why I'm wearing a sweatshirt. I'm like cold.
Yesterday it was hot. Well, yeah, I mean, I'm from the Midwest originally, so to me, 77 was just perfect, but I don't know. One of my tech people in Seattle was like, "Oh, I'm hiding out in the basement." And my Midwestern mind thought, "Is there a tornado in Seattle that I don't know about?" That's like, "Oh, she means it's too hot." It's 85. Right? I'm like, "Oh my God, that's like
wonderful." Yeah, right? Like it would be like that all the time.
Now it's about 50. So,
yeah. Oh man, yeah, that's a little chilly. Well, I will let Susan talk a little bit more about what she does, but let's take our 3 deep breaths. Even though I'm not as frazzled as usual, it's good for us. I always talk about why. It's good for our nervous systems. It's good for our brains. This might be one of the only times today I remember to take 3 deep breaths. So I need it as much as I offer to you all. So Susan, feel free. You might not need it, but if you need in through your nose, out through your mouth. If you're watching out there with me, you know, you could do it as well. So here we go. First breath. And again. One more.
I'll tell you why I'm laughing. Did you ever watch Star Trek: The Next Generation?
No, man, I did not.
Oh, man. Okay. So there's this character, Reginald Barclay. He's kind of like neurodiverse, anxious. He's a walking DSM. And so he goes to the ship's counselor and she starts talking about deep breathing. And she said, in through your nose, out through your mouth, just like you did. I'm like, oh my God. And then he leaves the therapy session right away. Oh, you've cured me. In through your nose, out through your mouth. And he's just like walking down, in through your nose, out through your mouth. And it's just hysterical. But a lot of us geeks really enjoyed him because he was like us normal people, not being perfect.
That's right. And that's what we're here for, right? We know that's what
exactly
is about. That's what life is about. And dear God, that's what mental health treatment is about. Like, so, all right, Susan, tell us like who you are, what's your work background? What do you do now? Bring us up to speed.
Well, I have kind of an interesting past. It was certainly not what I intended. When I started, I thought I was going to be in private practice like everybody else. Got my license. First job working at an EAP. I was like, great, I'm working. I'm finally being a counselor after all this time, and I'm, late 20s, making the equivalent of, I don't know, a little under 50,000 for having to see 36 people a week.
Yeah, 36?
36 we were supposed to schedule 36. Have 32 average show up, 7 had to be intakes per week. Then they added on, and then they added on call once a month. And it wasn't just on call for like emergencies. It was, we had to go to the hospital because we'd been acquired by managed care at that point. I didn't even know what managed care was, let alone who had acquired us. Turned out that it became Magellan, but it wasn't that at the time. And so we were supposed to go to the hospital when somebody was presenting for psychiatric admission, and we were supposed to find a reason not to admit them. I was like, no,
that's
no, just no. And oh, by the way, no extra pay. No extra pay for that.
No.
Yeah. So I was like, falling asleep in sessions. What do you, second session would be 7-8 weeks down the road because there'd be no appointments. And then I'd be like, okay, who are you? Why are you here? I don't say anything, Susan, just go, and hope they say something to trigger my memory. Cause my notes weren't done. Cause I had no time to do my notes. And then, I thought, okay, this is dangerous. I'm getting out, going to someplace non-clinical because at least I'm not going to screw anything up.
Right.
Went to what they called the National Service Center. I didn't really know what I was supposed to be doing. It turned out I was supposed to be reviewing people's treatment plans to deny. Oh, no. Yes, Alana.
Right.
Never get paid.
Oh, feel you, girl. We've all been there.
Broken, and they're broken beyond anything you even know. And that's kind of what started how I ended up today, because I was like, it's like a train wreck. You can't look away. Yeah. I learned about managed care and I'm like, what the bleepity bleep is this? And so then I started, all right, I'm going to represent my colleagues some way. First, I was doing the damn, pardon my language, treatment plans, putting it in the appropriate language so that people could get paid. And then I'm like, oh, I'm done with this. So then I learned billing, and then I learned credentialing, and I thought I knew what I was doing. And I kept making the same mistakes everybody does. And 27 years later, here I am. And a couple of years ago, I was really facing a lot of burnout. And if you read yesterday's blog, there's a lot of stuff in there about what billers are going through, especially the small billing services. And I was right there. I was feeling it when I was writing that, because that's me. That's my billing colleagues. And I reached out to Barbara Griswold with this idea. I said, what would you think about a biller who's just a consultant, who people can ask the hard questions for help with, just like the safety net rescue kind of claims, like, 95, 96% of your claims is just submit. You use therapy notes or simple practice or whatever, no problem.
Right. That's right.
But the ones that you get stuck on, what if you could?
Yes, we feel you, Alana. Yeah,
we do. We feel you.
We with you.
Yes, exactly. I was telling Sarah before we went live, I'm a biller, so 4-letter words don't offend me. I've used them, and they may come out.
And I told her it's fine because my audience is used to the 4-letter words.
Gotcha.
I can't get through a day without it.
And I've worked with Barbara as a consultant, especially around Medicare, for like 12 years.
Okay.
And she just looked at me. We were on Zoom, and she said, Susan, I have been waiting for you to do something like that. And I'm like, Thanks. You could have told me.
Give me that push. Yeah.
It's like, you could have told me. So I am so grateful for her mentoring and everything. I'm going to miss the heck out of her when she retires.
Which is
now, but
yeah,
the whole world is like, oh no. But so I started Psych Building Coach, and then my spinoff is going to be called The Rescue Builder. We're not yet live. We're in beta. It's going to be, it's not on the Wikipedia engine, but it's essentially think Wikipedia for mental health billing. And that's what it's meant to do. It's not really one of those courses that you take, like, you know, be your own biller kind of, learn everything about mental health billing and in 8 weeks and then you're done. This isn't what it's about. This is about, what do you do if you get stuck? I have a lot of people say to me, well, I'm happy to follow the rules. I just don't know what the rules are. And you call the insurance company and you get, 10 answers to a yes or no question.
Exactly. They don't fucking tell you what the rules are.
That's because they don't know. A lot of times they don't know. They're just trying to get the hip. They're just trying to get you off the phone as fast as possible, because when you work at an insurance company call center, I've done it, they monitor you on speed of call resolution. So
in other words, like me, dear God.
Oh no, exactly. They try to get you off the phone, and the longer the calls go, the more their talk time average goes up, and that's when they get dinged.
That's such
right.
Shit too.
Of course it is. Right. It's all about corporate. Let's put obstacles, because a certain number of people are just going to say, F it, fuck it.
That's right. That's right.
And that's what
I'm not the one. Do. I am not the one.
And neither am I. And I'm like, the harder the claim, the better I like it. I got really tired of just keying in numbers.
Yeah.
And there are so many trends out there. I'm starting a new blog series. I just did the first one on attestations, and the blog series is called Death by 1,000 Cuts. There are so many little things that insurance companies are doing to push more work on providers so that they get to save money. They get to gaslight on the providers when the providers don't do it. And it is rebounding on the billers too.
It's
because
ridiculous.
Like, think about all the times you get a virtual credit card. Now you have to process that. Forget about the fees, even though the fees are bad.
Exactly.
But then you have to go look up the EOB on a portal. Well, it's death by portal, right? Because you get 10 of those, and the insurance is like, oh, it's only 5 minutes. Okay, well, 10 of those, now it's 50 minutes. I just could have had a session for that.
Exactly, right? And let me tell y'all, as a solopreneur, private practice clinician and owner for the last 9 years, Anthem Blue Cross Blue Shield sent me to collections for $100.95 that they said they overpaid me. And I am then at the mercy of having to prove they did not overpay me so that they don't take the money back. This is the fuckery that happens. This is why your mental health providers are drained and burned out, let alone
and leaving.
Leaving. Very, very taxing. The work itself requires so much of us. And then I have to deal with a multi-billion-dollar company sending me one provider, maybe billing 50 to 70 Anthem claims a month total for $100.95. I cannot make this up, guys. It's happened more than once.
True. It's true.
Has sent me to collections more than once because I refuse to fucking pay them. You know what they did instead, guys? Oh, they get their fucking money. You know what they did instead? Because I was like, I'm not doing this.
They take it out of another claim.
They take it out of another claim for a completely different client that you build services for, and they just take it right back.
Okay. I am going to blow your mind right now, right here. That's illegal. There's a federal law called ERISA, Employee Retirement Income and Security Act, that says you can't do that. And there are court cases I have in my files. It's all going in Rescue Builder when I go live. It's freaking illegal. And what I do
How do we fight it?
I'm sorry?
How do we fight it? They fucking do this all the time.
But they're convinced you don't know any better because you didn't go to law school, right? You're a social worker. Okay.
Yeah.
And for $100, okay, they're thinking $100 from Sarah, $100 from Susan, $100 from Jane, $100 from John. Okay, it adds up, right? Did you see the news yesterday that United Healthcare is now being sued because they are cheating their ex-employees on their IRA.
Holy fuck, man.
Did you see that?
No, but like,
Oh my, it came out yesterday. Somebody sued, a group of ex-employees sued because apparently something to do with their IRA investing, and I don't know all that
like when you
financial
get
stuff.
vested, they're supposed to match it, and then when you leave,
Right,
it
and
should
then
be
when you
vested,
leave, right,
and
and
then
then
they
they
just
kept
didn't match
money.
it. Oh
Oh
my
my
God.
Yeah, but their new CEO, right? They gave him $60 million right out, or their new old CEO who came back. Yeah.
Okay.
Yeah.
Yep.
Nice.
Right? No.
Nice.
This is what happens,
Exactly.
guys. This is
Exactly.
why. Okay, and let me also tell you guys something else. I take insurance. I've taken insurance the whole time. I started with like probably 15 insurances that I credentialed with. I'm down to like 3 or 4 because they all have a different contract. They send you a new contract whenever they feel like it, and you don't have to sign it, but you have to accept the terms or you come out of network. And trying to keep up with everybody's contract requirements just too much for a solopreneur who's fucking doing it all. So I dropped a bunch of insurances and now like only take a few insurances, and they don't you can't negotiate your rate. I mean, you think you
You
can,
can, but it's difficult.
it's super difficult. Let me like super
I
difficult.
have managed, but people pay me to do that, and there's no
Exactly.
guarantee. And the other thing is, a lot of it depends on demographic and need and who you get and all that. But here's the thing that kills me is the gaslighting. Okay, have you heard the term ghost network?
No.
Okay, a ghost network is you have a network of, let's say, 300 providers in your city, but yet somebody's looking for an in-network therapist can't find anybody because nobody's taking new patients, even though they're in the network. And they're like, oh, it's all those greedy providers. It's all those greedy providers. They're just, and so that's why all these attestations and blah, 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 directory, blah, blah, blah. And they're avoiding the really obvious elephant in the room, which is if you would freaking pay these people enough. There you go. Yeah. If you would freaking pay these people enough and make their lives easier,
that's right.
they would take insurance.
Exactly.
Because clients need insurance in order to see a therapist.
Right.
Duh. It doesn't take an MBA from Harvard to figure that out.
It doesn't, right?
And they do everything else but. And so we were going to talk about the platforms.
Yep.
And so this is a great segue into the platforms because the ghost networks are one of the reasons the platforms stepped in is to provide enough therapists. Only the ghost net or only the investors in the ghost networks are the freaking insurance companies.
And that I just read that in your thing and I'm like, well, that makes sense. That pisses me off a whole lot.
Yeah.
It's like, okay, guys, if for anybody that knows anything about research, let me explain this to you, especially for like human research of any kind. So any research they do for, let's say, mental health services, providers, blah, 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 right? Like this has been the case. So they're doing research to find out best practices or this or that or da, 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 da. If the research being conducted is being paid for by a company that's going to benefit from the research, it's fucked up research. We're not objective here, guys. Like there's an influence there on the research result. They're funding it, and they're also funding it to prove what they want to prove. That's what we're talking about right here.
Well, and here's the deal. In academia, they have to disclose that, right? This research was funded by so and such drug company who, has, and disclose that I'm an investor in blah, blah, blah.
I mean, it's the fine print. You got to read the fine print, but it's
well,
there.
But at least it's there. Guess what? Who's telling anybody that, Rula is sponsored by Blue Ventures? You know how I find these things out? I dig into stock things, and I know nothing. I wish my dad was alive. He was in the stock market. I know nothing about the stock market. Okay, SEC filings and this and that, but it's all public information, public companies. I dig and I dig and I dig and I snoop and I snoop, and it's like, oh, look what you found. It's there. It's just they're confident that nobody's going to go looking for it. And so a lot of what I did when I published that blog and I put those citations of, okay, Alma is funded by these people and Headway by these people and whatever is, I was reading press releases and it was all, yes. And it was all, oh, we're so wonderful. We just raised, $40 million from blah, blah, blah. Pat us on the back. Aren't we great? And
You didn't raise the money. Somebody fucking gave it to you. Anthem Blue Cross and Blue Shield took $100.95 from me and John,
Exactly.
Jane and Julie and fucking everybody else and funded that. So
exactly.
if you guys
And
are
here's the
getting
thing.
it, the insurance companies are profiting from these big things, and the big things are profiting from working with insurance. And guess who's getting screwed? The providers and the patient.
Yes. One of the things that a lot of clinicians don't know, and in my consulting work, I would say more than half.
I would probably agree with you.
Work with the big box platforms. They're trying to get off. That's one of the reasons the two reasons that I get people calling me who work for these Alma, Headway, Grow, whatever, is they're trying to get off, or they want to know, is this legit? Do I want to do this? Or one of these companies is doing something that's kind of tripping their ethical triggers and they want reality. Okay. So I've got a blog that came out last year. If you're taking Medicare Advantage or Medicare or Medicaid through one of these, you better read that blog. Sarah, I'll send it to you. It's called, what's it called? God, it's too early. I can't remember it, but it's basically about all of the federal crimes that you can be convicted for, like False Claims Act,
Dude, I have told people like that I know in the Richmond area, like friends of mine that say, oh, I'm going to go into private practice. I'm leaving group practice. I'm leaving community services board, right? I left community services board, started my own practice. I did not go to a group practice. I interviewed at a group practice and was like, oh no, I'm not giving up 30 to 40% of my income to somebody else. Like I barely make money now. And talking about it. And what was it? It was Headway. I think one of them had like a big, what's the other one? Headway or one of them had like
Headway, Grow, Rula.
BetterHelp?
Oh God, BetterHelp. Well, BetterHelp's a little different because it's not.
Maybe it was
BetterHelp is, yeah. Something
and there was
different.
a huge lawsuit, and I sent it to a colleague and a friend, and
lawsuit.
I was like, I would double check everything that you have with this company in which you work for and provide services, because they just had a huge lawsuit for selling client information. And my friend was just like, don't care. And I was like,
yeah.
Oh my God, you understand they will throw you under the bus in a second?
Yeah.
There is like a violation where you're the one with the license, honey. You have the license.
Right. Okay, so BetterHelp had one, and also Headway was sued because do you know who else one of the major investors is in Headway? Google.
Oh God.
And if you look for a therapist as a client anymore, just go to Google, maybe even use a friend's device that isn't registered to you and go find a therapist. First page, Rula, Headway, Alma, and it's like you may get individual therapist listings. You may get Psychology Today on the first page, maybe. And then, so therapists are saying, why doesn't Psychology Today work for me anymore? Well, how many people scroll past that first page of search results? Okay. Oh, and I looked up the blog. It's called Medicare versus the Mega Groups. The Clash is Coming. It was put out last August, and then I updated it this month, because what I forgot to say is that every single scenario that I wrote about in that blog, somebody confided to me was actually happening. I didn't make anything up. I mean, I didn't mention names.
Right.
I'm not eager to be sued by people with many more zeros in their bank account than I have, but every one of those issues was revealed to me in a consultation, and I went, that's a federal offense, guys. And one person
people aren't realizing that Medicaid is usually a state funded government,
state and federal,
and Medicare is federally funded, right? So we're not just talking about commercial insurance like Blue Cross Blue Shield, right? And where you have liberty, or self-pay where you have liberties. It's like you don't have the same liberties when you're working under government regs. Anybody that worked in community services board or some sort of agency setting knows this. Like regs upon regs upon regs, and Medicaid, and they will audit you out the ass and take the money back. And
it's even more creepy than that, right? Because I ask it comes up all the time in consultations. I say, do you know what Medicare Advantage is? And I get, well, sort of the deer in the headlights. So let me give you the 2-second answer about Medicare Advantage. When you turn 65, you get, and you sign up for Medicare, you get a choice. You can stay with government Medicare, or you can have your Medicare handled by Blue Cross, United Healthcare, Humana, Aetna, and that is called Medicare Advantage. Okay, so if you think you're taking Blue Cross through Headway, you might actually be seeing Medicare. So you don't even necessarily know. And that's why those platforms, just so you know, will tell you you can't be opted out of Medicare, that you don't have to enroll, but you can't be opted out, because if you're opted out, Medicare Advantage plans can't legally pay you. Okay? Yeah. So that's how crazy it's gotten, and people don't know that.
And Medicare Advantage, okay, so
Advantage.
Medicare Advantage plans are managed care health insurance options from commercial insurance. They are managing
Yes.
your Medicare
Yes.
benefits. So
Yes.
you guys are getting that, right? Like, the commercial insurance is managing your Medicare, not the federal government at that point. So
Yes.
that's super interesting. That
Well, think about it like this. If anybody here does Medicaid, I mean, everybody knows that Medicaid is pretty much farmed out to the managed care companies, right? Medicare Advantage is just that for Medicare instead of Medicaid.
Right. And so this is like the Optima Family Health Plan and whatever the hell else name it is that you have to decipher is like, oh, this is a Medicaid plan.
Exactly.
This is a Medicaid
And I
plan.
teach
This is not a commercial
looking
plan.
at insurance cards and deciphering what is right there in plain sight.
Okay.
I have a webinar about that on my website. It's going to be all over Rescue Biller. I am putting together all kinds of stuff. I've already done one lesson. It's hysterical. I don't know enough about Virginia Medicaid to know who your Medicaid payers are, but there's this company called Centene, Centene. Nobody's ever heard of it.
Okay.
Until I say, oh, have you heard of Ambetter? Yeah, sure. Well, that's Centene. And they do Medicaid in about 27, 30 states. And in every state, it's a different name. So that's how you don't know to connect it. They are the most corrupt company that nobody's ever heard of. I'm not saying United Healthcare is wonderful, right? Okay.
They're not.
But Centene gets away with a lot because what they do is they just go, oops, so sorry, it was a systems issue. We'll pay our fine. And I've got a whole long list of fines on my site that they have paid. I think it's something like 1.9 billion over the last decade or something like that. And states continue to hire them.
And they still have money, y'all. So that's the other thing that you need to get. She just said that they, over the last decade, they've paid like $1.9 billion in fines and are not bankrupt. Does that tell you how much money they have if they've paid that much in fines and are still functioning? Yet, let me also just say this. Let me be on my soapbox for a second. They don't pay us shit. And just for people, because I did not say it enough, which I did, but I'm going to say it again. Anthem, Blue Cross, Blue Shield did not give us a reimbursement rate increase for 5 years. I ran with the same reimburse rate from 2020 till 2025, y'all. So when inflation went to 40%, everybody was getting a raise and all of this. No, Sarah was making less money than everybody else because they don't give you a raise and you can negotiate it. I did actually negotiate a rate increase with United. That took a while. I did with Aetna too. Also took a while. Both of them told me a start date of when it was going to be. Both of them were over 6 months later and actually starting the rate increase that I negotiated as a solopreneur, which is like almost unheard of, but I wrote a badass letter that they couldn't really deny. And United gave me a 10% raise above market.
Cool.
And Aetna gave me a 7% raise above market. And United and Aetna are still my lowest paying insurances that I take. Still, guys. And I negotiate higher than like everybody else in my area on market rate. And Aetna gave us a raise in the last 5 years. It was like $2.17. Y'all, like this isn't even that's not even a 1% raise.
Don't spend it all at once, Sarah.
Ridiculous, right? So when I say like, not only is the work hard, it's like we are not paid enough to literally pay the bills and keep the lights on. Like, can you imagine working at a place and not getting a raise for 5 years? Because that's what it is.
Mm-hmm. And then they wonder why people don't join the network. Why do you think they are now covering associates, which that's the term here on the West Coast for people who've graduated and are practicing under supervision? That was unheard of before the COVID pandemic. That was unheard of. They have to do it now because every state has what's called network adequacy laws. In other words, an insurance company has to provide a network, right? That's their product. So you can't sell a plan and say you have to use in-network benefits to get a better rate and then have no network.
And then guess
who's getting sued? There's 2 lawsuits now in New York City for in an inadequate network. Guess who's getting sued? Anthem. Because in New York City, where it's the most expensive place in the country to live and work, do you want to know how much social workers make in New York City if they're participating with Anthem?
Tell me.
It's $80 for Anthem Blue Cross. And if you are contracted through Carillon, which used to be Beacon, which they bought in 2020 and merged with, then you take the both the city of New York employees and the state of New York employees. The state of New York, a social worker will make $67.
Huh.
And that's the same whether 90834 or 90837. They don't vary it. It's just the same rate. And for the city employees, $55.
Oh my God.
That is the same rate that they have paid for 15 years.
I believe it because I dropped Cigna because I asked for a rate increase years ago when they were paying $59 for a 90837. This was probably like 6 or 7 years ago, guys, like not that long. And I asked for a rate increase knowing that like literally the person in the office like down the street got one and they didn't give it to me. And I'm like, fuck it, I'm out of network then. Because like you guys don't understand, like it'll cost me more than $59 an hour to like keep the lights on for my business, let alone.
They understand very well. They're just what they're doing is they're kind of trying to play off all sides against the middle. They're succeeding very well. And now they've got these platforms. And the reason they give higher rates to people on the platforms is because number one, they own it, so they're getting some of it back. Number two, one of the big selling points of these platforms is we'll get you credentialed fast, right? 2 to 3 weeks as opposed to 9 months. Well, the reason is because they have what's called a delegated credentialing contract, meaning it's Headway that's doing the credentialing, not Aetna or Anthem or whoever. So Headway does it, and then they just click you into what's called the roster, and they just say, okay, Sarah is practicing under our NPI now, and the insurance company just goes, oh, okay, and then that's it. There's nothing the insurance company has to do, so they're saving money, which means they can turn around and give more to the platform, but then they're taking some of that back when the platform rakes in their cut. And patients pay more, clients pay more. Here's why. You have a high deductible health plan, which half of people with insurance companies have a high deductible health plan. Okay, so let's say I'm seeing Sarah. She's on Headway. I know you would never do this, but let's just say, let's just say I actually had insurance because I can't afford it anymore. I'm uninsured, by the way. The big billing guru is uninsured. Okay. Be that as it may, last year I had a $7,000 deductible on the marketplace. Okay. So if I'm seeing Sarah with my $7,000 deductible and Sarah's
getting go through it in a year.
Not unless I am hospitalized, and we're going to hope that I'm not.
Exactly.
For the next 6 years until I turn 65. Okay. Yeah. So I now just told you my age. But that's okay. There's a reason I have these gray hairs, right? It's because I'm dealing with insurance. So anyway, if you're making $125 from Headway And you're thinking, great, because whatever insurance plan it was would only pay me 80, if I was in my private practice. So you're thinking, oh, great, I'm doing great. Well, I guarantee you Headway's not billing 125. They're billing 150, 175, 200, whatever. Okay. And their contract rate is not disclosed to you.
That's right.
You don't see the EOBs, so you don't even know. Okay. And I am the patient who may not know any better, might be paying $200 a session until I meet that $7,000 deductible, but I don't know as a client that Sarah is only getting 125.
Right.
What a scam.
It's such a scam.
What a nice little scam.
And the other thing with that, guys, the reason, so the thing, I want to say something about the credentialing. The reason they credential you fast is because they don't credential you. You are credentialed under the group MPI of Alma of Grow. I am credentialed with my own MPI with Anthem, Blue Cross Blue Shield, with Centera Optima, and the ones that I take. And I have a group MPI, which I don't use anymore because I needed it for Medicare, and I dropped Medicare because I'm not a sole proprietor. I'm an LLC that files taxes as an S Corp. So for Medicare, I'm not just a solo provider. I'm a provider within a business. So the business needs a group MPI and the provider needs a single MPI. And so I had
I do a lot of Medicare enrollment because Medicare provider enrollment's a nightmare. And yeah,
it is. And I did it myself, y'all. I did it myself back about 9 years ago when I was figured it out, right? Which is why I had to get a second MPI, which I literally only use for Medicare. Now I don't use it anymore because I don't need to use it to differentiate. It's just me as a provider. Now, if I hired somebody for my practice, I would need the group MPI. That we would be billing the group MPI for the practice and the provider MPI for whoever gave the service, right? And so the reason the credentialing is so fast is because they aren't credentialing you as the provider. They've already credentialed the group, which is Alma Grow, and then they just add a provider underneath the group. I can do the same fucking thing. I literally can do the same thing.
There's lots of groups that are trying to become Alma, Headway, Grow, etc. And the reason that a traditional group practice is because venture capital.
Yeah.
They don't have the money to have the technology that Alma, Headway, Grow. And, I thought I was just wasting time playing around, and I did an experiment and I wrote about it in my blog. It floored me in a new way yesterday as I was like, oh, let's just pretend to be a patient and go through one of those.
Say the whole thing that you did. Yeah. Cause I just did this.
Okay. Yeah. So here's what I did. I created a fake email. I wanted nothing to connect to me in any way. So I went on Yahoo, brand new email. Okay. Fake name. Okay. I went on and I said, I'm going to self-pay, because you can self-pay on those platforms too, by the way.
And not
why anybody would do that. I have no idea. No idea. But anyway. Okay. So then I'm like, all right, I live in, zip code, show me therapists. It gave me the freaking PHQ and GAD. I had to sit there and take it. And I'm going,
for them to show you a list of providers?
Before they would show me a list of providers, yes.
Okay, so for you guys that don't know, the PHQ-9 is an assessment tool to determine your level of depression, and the GAD-7 is an assessment tool to determine your level of anxiety. So they are tracking symptoms that you self-fill out on this self-assessment form. And so Susan is saying, as a fake patient, they made her fill out these assessment forms about her mental health symptoms before they would give her a list of accepting providers.
Yeah, right. And had I done my insurance, I would have had to put all my insurance information, my real name, my real date of birth, which, I faked it all. And what I also did is I thought, oh, this is interesting. I'm going to score myself the most depressed and the most anxious I can be on these things and see how many times they reach out to me on my fake email. Once a day now, I'm getting email on that fake email. Are you still needing a therapist? Oh, we care.
And okay, so that in and of itself is like, I can't do that, y'all. And most practices that are run by normal people do not have the capability to send an email every day to solicit you for therapy services. Like, and that's the thing. They get a lot of people coming in because they can market and do that.
Well, it's even more creepy than that, because what they're doing is they're taking all that data,
yeah,
and they're creating what they call value-based care, because
right.
they have a lot of people
this pissed me
that
off.
they're collecting data on. What are they doing with that data? I mean, Google is one of their investors in Headway, right? What are they doing with that data? Does anybody know? I don't want my data on there.
No, and let me I'm going to read this thing from your thing. Okay.
Oh, go for it. Yeah, sure.
Let me tell you guys what she says about value-based care. This refers to the concept of structuring healthcare delivery to pay for outcomes rather than per procedure. It's a new name, but not a new idea. And in theory, it's attractive. It can reduce fraud, over-utilization, maintain quality. What could be better? But measuring quality and outcomes of behavioral health has always been difficult, to say nothing of tying reimbursement to quality and outcomes. Let me explain this for people who are not in this world. When you bill based on a procedure, it doesn't matter how the outcome of the procedure goes. They still did the procedure. Okay. I'm going to make up a scenario. You have appendicitis, acute appendicitis. So you go in to get your appendix taken out, an emergency surgery, essentially, so that it doesn't rupture and that you don't die. The procedure is the surgery for taking your appendix out, which is what we bill insurance for. The procedure code. What did you do? It's this set of numbers equals blah, 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 surgery. Okay. So if they bill based on the outcome of that, I don't know if I got better in 4 hours, in 6 hours, in 4 days, in 2 weeks. When did I go back to work? How quick was I ambulatory when I got up? If they build based on outcomes, and it took me 48 hours to leave the hospital instead of 4 hours, they're going to pay less. Are we getting that? So if
it's a little different on the medical side, because what these plans are is
right? Like, this is like, we have procedure codes as well. Ours are for time. They're not for like appendix surgery versus foot surgery versus brain surgery, right? Like, those are all different procedures. Our procedure codes are based on time. So how long did you spend with the patient in psychotherapy?
Well, if there are any nurse practitioners or psychiatrists in the crowd, or billers for those, for the prescribers, that's only partly true. The psychotherapy add-on component is time, but then they have what's called an evaluation and management code, which is based on severity. Now, get this. Get this. Just yesterday, a nurse practitioner in Oregon sent me a memo that is saying that an Oregon health plan, it's called Providence Health Plan. It's a big hospital system here on the West Coast. Okay. They are no longer going to pay for the highest 2 levels of E&M, because E&M is based on levels. And so the highest levels, level 5, they get paid more than 4 than 3. Okay.
Right.
So they're no longer going to pay for psychotherapy add-ons for level 4 and 5, because we don't believe that you can adequately differentiate the medical service from the psychotherapy. And so you're just inflating your charges, essentially. And so anytime you bill that, it's going to be denied. You have to appeal it 100%. I am going to fight that. I am so going to fight that.
Okay, so if you guys think about this, a nurse practitioner that can do both can prescribe medication and do some psychotherapy. These are 2 different codes, guys. These are 2 different services. Providing medication and medication management is different than providing psychotherapy. These are 2 different services that the same provider can offer a patient in the moment. And so what Susan is saying here is that they can no longer essentially bill for those 2 services. You could bill for one, even if you're doing 2 services as one provider. This is another way that they fuck us over in pay, guys. Like, that's it. I can't, my brain I'm so pissed off. Like, all of it. Like, government pay is bad. Commercial pay is bad. People can't afford self-pay, and Alma and growth therapy and everybody else is just like screwing it up. let me tell you my experience with this. So this was probably like 2019, maybe ish. Maybe, yeah, like probably 2019. And so I've been in private practice like 3-4 years at that point, doing it myself. I told you guys I've done everything myself. I've done everything myself for 9 years. I've never hired somebody like Susan. I have fought all of my own insurance claims as I have.
You're a rare breed.
Oh yeah, man. You don't want to fuck with me and my money. No, sir. No, sir. And this is why I haven't hired somebody like Susan, because I need to understand my money. I sit down. I mean, for like the first 5 years of my business, I had long meetings with my CPA, having her explain everything in my business taxes to understand what is what. No, and same with my investment advisor. I don't know any of that shit, but you will teach me, and then I will know what to look for with my money, period. And like, I'm anal retentive and obsessive compulsive about it, and I won't apologize. No, I have to be in control of my money. It was a lot in and of itself to hire a CPA, but
well, you know what? Even if you did hire a biller, you still need, it's your practice, it's your license, it's your reputation. You still need to know. And that's why I'm all about teaching.
Exactly. You're going to educate.
Whether you hire a biller or not, whether you, I mean, I would hope that you don't have to use Grow or whatever, but even if you do, you should still know. And then hopefully the more you know, you are empowered to get the heck out of there. But I'm not going to judge. I'm just going to teach. And people's eyes just get opened. Like I said to you, it's illegal to claw back against another patient. And all that's going to be in the rescue biller. And I'll tell you another fun topic. So, the shooting of Brian Thompson, right? The United CEO back in December. Yeah. Okay.
Who doesn't know that?
Well, yeah, I don't know. Maybe people in Europe. Anyway, it was funny. It came up in every single consultation. The very first one I had that day was like the therapist got on and she had a complaint about United, and she started off by saying, "I didn't do it." Anyway, so the New Yorker contacted me the end of December because social media, traditional media, was just full of angered insurance companies, right? Yep. And so they featured what I do, and my signature kind of thing that nobody else does is I write like badass letters, like what you're talking about, Sarah. And I find the name of the CEO, and I'm like, okay, when you want a raise, no, you're not just going to go to Anthem customer service, because all they can do is say no. We're going to find you somebody higher up that can actually read it, because a lot of these appeals, guess who reads them? AI. A person doesn't read your appeals. You're AI. You got to go higher up for a person whose first language is English and who has a brain and who understands the law.
That's right.
To actually get it done. And I write it, and I can send Sarah the clip for the New Yorker. It's hysterical because it's like, I just, very sweetly say, Anthem, are you aware that you might be in violation of the Federal Employee Income and Retirement Security Act of 1974? And I'm not a lawyer. I just say maybe you might want to consult your counsel. Oh, no problem. It's a systems issue. They always say that. It's like, come up with something better. Come up with a better excuse. No, it's a systems issue. Oh, man.
Your system, really? Your billions of dollars is all I have to say.
Yeah, it's a systems issue because, sorry, you disrupted our system. But you know what? They'd rather pay. Here's why it works. They would rather pay you what they know you're entitled to so that you don't make noise and you don't get them into trouble. And here's how it works is I always tell people, carbon copy. If it's a federal program, your senators, your representatives, the attorney general of your state. I love it when New Yorkers call me because their AG is badass. And I can win a case in New York like that just because
that's great
advice. You copy Letitia James, you're going to get you're going to get it. She's out for the insurance companies. Those of you who have, if you're dealing with TRICARE, okay, whatever. And TRICARE is a freaking mess right now.
Never took TRICARE, and I do not regret it.
Yeah. And the other thing, a lot of these, Medicaid managed care, Medicare Advantage, even TRICARE contracts are legally allowed to do when they privatize it, is they're legally allowed to pay providers less than what the government would pay you for serving in the traditional programs. So like if you're just going to take Medicare,
Right.
Straight Medicare, traditional Medicare.
Dollars. Yeah. They're going to pay you X dollars.
They're going to pay you X dollars. And you can look that up. It's public information.
That's right.
United averages about 80% of that. Humana,
right.
60%. Aetna is actually pretty good. They pay 90 to 95% of it. That's why they got in trouble last year, because their medical loss ratio was too high. The medical loss ratio is the amount of money, the amount of premiums that goes towards claims. So the target is 85%. The government requires 85% on ACA, Medicaid, Medicare be paid towards claims. That means they get a 15% guaranteed. We can take that home. Okay. And then I think for other commercial plans, it doesn't even have to be that. It can be like 80%, I think, because the laws governing commercial plans, it's not all ERISA. It's different according to federal or state. Okay. So here's where it really gets messed up is, where am I going with this? Oh yeah, risk adjustment. So we're getting into the time of year now where if you've been treating people with marketplace coverage, Medicare Advantage, Medicaid managed care, even if you're out of network, if they have out of network benefits, you're still going to get this. It's called a risk adjustment audit.
Yeah, that's right. Yeah.
This is the one.
Anthem always does it like at the end of the year.
Yeah. Oh, and the end of the year, they do that on purpose that people won't pay attention because it's the holidays. Okay. And there's a blog on my website about that. It's called Stop Data Mining and Risk Adjustment, because what they're doing, it's been documented. It's been documented for over, at the earliest I saw this was 2015, but I think it goes back further than that. What they're doing is they're doing something called upcoding. Okay. And that means they are looking for every diagnosis that this person has ever possibly had. Okay. So like if I'm going to my doctor when I had a marketplace plan and I'm seeing her for asthma, but let's say 10 years ago I had depression. And let's say I don't have depression anymore, but it's in my EMR, my chart. They're going to pull that.
That's right.
Okay. Because that's going to make me look sicker.
Yep.
Okay. So they do that with everybody. That's why they're asking for all these records. And then the more they can prove that their clients are sicker than estimated, the government gives them extra money. That's why those risk adjustment audits are happening. And that blog talks about what you can do to preserve your client's confidentiality. You do have to answer it, but there's a letter you can answer it. Well, you write a treatment summary and you confine it just to your treatment.
Yep.
And if they harass you for more, which they will, there's things you can say.
I have not done that. I write a letter, just citing mine, and that's all I send now for those.
Right. Well, a lot of people, they play the game of, oh, I'm sorry, we didn't get it. Can you send it again? Oh, really? You didn't get it? You mean you lost confidential personal protected health information? What's the name of your compliance officer? And see, I attend medical
that's good
seminars taught by real experts who tell me these things. I didn't make these things up. I was like, whoa, I didn't know that. My billing education didn't even start until like 3 years ago. I mean, I've been doing this for 26 years, but I mean, I say this to my employee all the time. I mean, psych billing coach and rescue biller, the first person they taught was me.
Right.
When I started really digging into this stuff, it was like, I mean,
let me tell you guys,
system is so sick.
It's so bad. Let me give you an example of a systems error. Okay. In October of 2020, y'all know what the fucking world was like in October of 2020? I can't even begin to describe how burned out I was by October of 2020. Okay. In June of 2020, Anthem Blue Cross Blue Shield sends a communication to, I'm just going to go with all Virginia providers, that there's going to be a new contract. Okay, they send a contract whenever they want to. You don't have to sign it for it to go into effect. If you are in network with them and they send a new contract, you are then bound by the new contract unless you pull out a network. So do your best to figure it out, even though it's 350 plus pages when they send it to you. The thing that we all look for in the new contract is reimbursement rates. And I'm pretty sure they let us know that there was going to be a rate increase in October and told us like what it was gonna be, right? They give you the market rate sheet or whatever for your licensure level, your education level, whatever. Okay, so starting on October 1st, this new rate is to go into effect. Starting on October 1st, 2020, Anthem continued to pay out claims at the old rate for 6 weeks for everybody in the state of Virginia.
I'm going to be really sarcastic. 6 weeks. That's actually pretty good.
Oh, because I can't imagine how Kevin Bogger felt with everybody, at least in the Richmond area, flooding these people, right? With like, what in the actual fuck? You told us you were giving us a rate increase. You gave us the date for that. You sent us the contract. Then you violated your own contract for us. Okay, so you know what they told us? The system wasn't ready for, you told us in June. And in 3 months, you can't get your system ready to automatically read the claims and pay out the new thing. Let me tell you what I learned in that. Number one, I had to keep track of like every client I billed for that I didn't get paid the full rate on, because that difference in rate, I needed to be paid. So for me, it was like almost $3,500, which for a single provider business is a lot of money. I did not get paid and all of that, and I got paid in increments of that money that I was owed until the end of the following March. 6 months of not getting paid the correct rate. And then waiting for the back pay on that is a lot for a single provider practice, guys. And I emailed every week. This is why I got paid by the end of March, and a lot of my colleagues didn't get paid by the end of the fall. I was like, where is my money? Where is my money? Where is my money? I'm sure they were so tired of me.
They're hoping 2 things. Number 1 is that you'll forget about it or give up because it's too much effort. And number 2, even when they do pay you, okay, 6 months, when you have so many bazillions of dollars, they are making interest on that money. It's called float.
And they don't pay us interest.
Oh, no, of course not. Because they know in order to get that, you have to write to the state insurance commissioner. And who's going to do that for $5?
I
Sarah
did.
will.
I did, and a bunch of other people did. Let me tell you something about the SEC and insurance. They don't cover federal plans.
Yes.
They don't cover big business plans. They only cover marketplace plans. So of all the monies that I was waiting for, I only had 4 clients with marketplace plans. So all of the other Anthem, Blue Cross, Blue Shield plans, State Corporation Commission does not regulate and cannot help you.
One correction, Sarah. It isn't just marketplace plans that the insurance commissioner regulates. It's what's called fully insured. Fully insured means like, okay, let's say you have a small pizza joint, okay, and you have 10 employees, and you take out just a regular plan that you can buy through a broker. That's fully insured because it's the insurance company's premium. It's money that goes into their big general fund from premiums that they're paying you out of. A big corporation is what's called self-insured. The corporation is actually funding the claims themselves.
Okay.
It's not SCC, fully insured.
Yes.
Or state jurisdiction. Fully insured is under state jurisdiction, so is marketplace. But the original law that I told you, that is self-insured. The employer, like Google, let's say, will get together what they think all of their claims are going to cost them, and they're going to put it in a checking account, and they're going to give it to whoever administers their account, And so it's still an insurance company, folks. It's still Blue Cross or Aetna or whatever, but they're acting as an administrator. They are not under any financial risk. Now, here's where it really gets interesting. So I mentioned ERISA. ERISA was originally designed only for self-insured plans because ERISA is a labor law. It's not insurance law. It's labor law because if you're working for a big corporation and they're providing you insurance, that is part of your benefits package. So they're taking money from your salary to pay the premiums, or they're maybe paying you less because they're giving you insurance, right? Okay. So that's why it falls under ERISA. Now, when the ACA came along, the Affordable Care Act adopted ERISA rules in its entirety, thereby extending ERISA to everybody except employees of religious organizations and government. Yeah. So even on a marketplace plan, you can still file an ERISA complaint because ERISA adopted the ACA. You just have to use the right language with the insurance companies. And they're counting on you not knowing that. So then they can go, oh, well, you don't. You know, that's what I do.
Okay.
Is I put it in the language that they can't dispute because they know I'm right. And I don't write the letters under my name. I write the letters under Sarah's name.
Right. Yeah.
So anything I put out, you know, you have the final say. And, you know, I try really hard not to get snarky. It's difficult sometimes. And sometimes I just walk that line. A little snark is good, just not too much. I mean, I'll never forget the letter I wrote to, you know, Anthem's CEO about some play therapists in St. Louis, where for a 90834, they're still making $60. And, you know, anybody working with children right now, if you don't ask for a raise, you are cheating yourself because children are hurting. They know it.
Yeah.
Okay. Anyway, so I presented all these statistics or whatever, and then I showed how Anthem was like the lowest by just a ridiculous margin. Even Medicaid in Missouri was paying more. Medicaid.
Wow.
Medicaid pays more in a lot of places now because they want people to get help. Now that could change if this big, beautiful bill thing passes. But anyway, I said something like, you know, put your, you know, $20 million yearly salary where your mouth is and step up if you really want the children to get help. They got a raise. And then they walked, and I'll tell you why. And it was hysterical. It was hysterical because in the contract they signed, they were sent, these people were not Beacon providers, but in the new contract, they were added to Beacon. And we said, or Carillon. And we said, we didn't want to be Carillon. Well, why not? You have to be.
Exactly.
Well,
you did the same thing.
They added that New York City addendum saying you're going to get $55 or $67 for New York employees. And we're like, we're in St. Louis. Why do we need that? Okay. Well, it's legally required that it be there. No, bullshit. What if a student of a New York state employee goes to college in St. Louis and wants to see somebody? Now all of a sudden you're getting $67. Too fucking bad.
Right.
And so that was reason number one. Reason number two was they had moved like 3 years earlier, and I had changed the address, and I had kept screenshots and everything. I had changed the address like 3 times. So then they sent everything in the wrong address, and they said, here, can you confirm this address? And we're like, no. And so then we got this big scolding. Well, you need to change your address. And
motherfucker.
I wrote back and I said, oh, you mean like, and I attached all these screenshots. And they were like, oops, so sorry. And then nothing else. And then they were like, oh, well, now it's not going to start for another, you know, whatever, like 6 months and blah, 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 blah. And the practice was like, screw you. We're out of here.
Yep.
And do you blame them? I don't.
No, exactly. Right. Like,
I don't. Nobody with a brain does. Even the patients, none of the patients were even, the clients weren't even upset because they understood,
exactly,
you know, what it takes to live. Okay. And yet the gaslighting from the insurance companies, oh, providers are greedy, blah, 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 blah. You know,
Dude,
it's ridiculous.
it's impossible to be greedy in mental health. Let me just say that, y'all. If I could, I could go on all day because Susan, we talked about
Right.
let me just tell you what we go through to then be able to get licensed, to then be able to bill insurance and still get paid shit. I had to go into bed bug infested, cockroach infested, unclean places where clients were living to provide in community care. I mean, I had one client that had a lot of hygiene issues. Part of my job in mental health skill building was trying to get them to take care of their health, their mental health, their hygiene, their home, so they can stay in the community, which is teaching like cleaning skills, getting the things they need at the grocery store and the other store, picking up their medications, going to their doctor's appointments, socializing with people. It's all the things that you would need to like be functional and stable in the community. And when you have somebody who has like cleaning and hygiene issues, and then you go into their apartment and nothing is clean, literally, I mean, nothing is clean. Literally, I mean, shit is dripping down the toilet and they don't care. And I have to go into this house and tell this person that they need to clean or they're going to get evicted. And I was paid with a master's degree less than 15 years ago, $39,000 a year to do that, folks. Who else is doing that job at all, let alone for that amount of money? How dare you, any of you, say mental health providers are greedy? We are literally trying to keep our heads above water from every system that is trying to fuck us over and beat us down, and then wonder why we don't have mental health providers and why everybody's only taking self-pay and like, why is their rate $300? Because we are fucking worth it. I have put in so much work for no money. Let me tell you something else that I have found interesting. I have a client that got like a funeral services degree. It's a 2-year program. You can do it at a community college. Eventually, if you go through like you have to do like a year-long internship after you finish school, and then pass your board exams, and then you can be a funeral director. Okay, great, awesome. So she did her 2 years of school. She gets hired at a funeral home for her internship. It is a paid position for a year. I did 2 years of free labor as a graduate student.
Yes.
Master's program. They don't pay. Okay.
Oh, not only that, you were paying for the credits. You were paying the university for the credits. So now you have a student loan. So you're actually paying to work for free.
That's right. So that's one. I'm not hating on the degree. I'm just describing the differences. A 2-year degree in funeral services, 6 years of higher education, get a master's degree. I did 14 hours a week. My first year in graduate school, I did 21 hours a week. My second year in graduate school for free. So if you need a job on top of that, good luck, because the other days a week I was in class. Okay, so not only does she get paid, and she's making like $18 an hour now for her year-long internship. They have on-call for body retrieval and delivery to a funeral home or, morgue or wherever it's going, right? This is part of the funeral industry. So she goes as on call. And if y'all have ever worked with a mental health provider, I guarantee you at some point in their career, they were on fucking call, because like you almost can't get a job without being on call. Yep. And so she gets automatically paid. It's not much. I think she said like $10 or something, like for just being on call, even if you don't get a call. And then you get paid like a certain amount per call if you have to go out on the calls. Okay. That's in funeral services and picking up dead bodies.
Let me add this. How many funeral services people, after you pay for a funeral, face a clawback in 2 years because of some stupid little minor something?
Right.
Does that happen in any other industry but healthcare? Clawbacks. I say clawbacks, people are like, what?
It's them taking money out of another client that they're paid, that they should have paid me for from 2 years ago, $100.95 that they sent me to collections for. That's a clawback.
Right.
Okay,
Right.
so that's one industry. My spouse is in blue collar work. Always has been. He is a machinist and a welder and does things like that. He's a maintenance tech now. Okay, has on call as part of his. My spouse works for the Lego building here on the south side of Richmond, Virginia. Yeah, so Lego has a facility here. They're getting ready to build a different facility. My spouse does maintenance for the Lego facility. So they have on call so that they have coverage 24 hours is what Lego wants. In case something goes wrong in the building, they do the building maintenance to make sure like everything is working, right? Okay, so he automatically gets paid for 2 extra hours of work for the week that he's on call, no matter if he gets a call or not. And then if he does get a call, he gets automatically paid 4 hours, even if he's only there for 20 minutes.
Nice.
Y'all, I did on-call crisis work. This means middle of the night assessments for involuntary patient hospitalization in a psychiatric unit. This is literally people that are suicidal or homicidal and are not safe to be on their own or in the community because they're putting themselves and other people at risk. It is hard fucking work. And for some people, it's not fun. Those that are us not that into crisis things and being awake in the middle of the night when we're used to being awake during the day. I did that for no extra pay, no pay differential, and no support. So I was the only person on call to do TDO assessments for the entire county overnight for like a 12-hour shift when I had my on-call shifts. Overnight, 12 hours. I can't even tell you the PTSD I have from on-call shifts and like the crisis assessments I had to do, the lack of support, I could go on 4 days.
And
Okay,
you know what?
that's
I went through that in the early 90s. That shows you just how long this has
long.
been going on and how systemic it is and how nobody advocates for us.
Nobody.
I think I told you this when we were just chit-chatting, whenever that was. I had so much PTSD after the year that I spent on call that I was suicidal. I mean, I didn't try anything, but I was seriously thinking about, being dead would be better than working in this job. And I was being told to deny these people, right? So I remember one night, it was like 3 a.m. and I had been up every couple of hours back and forth to this hospital and that hospital. And we had to go anywhere in the St. Louis metro area, which St. Louis metro extends forever.
Yeah.
It's just sprawl. Okay. And so then I get this hospital social worker at the hospital says, we understand you have to come out, but we're going to admit her because the woman has this decades long history of schizophrenia. She's off her meds. She put her baby in a suitcase, tossed it out a second floor window, and she was found walking down the street because, she was in delusions and she was going to join. She was going to like go be with some pop star that was like her delusion. And so, of course, mandatory reporter, right? So they called, Division of Family Services or whatever. And it's like 3 a.m. and I'm exhausted. And I'm like, oh, you have my permission to admit her. And 45 minutes later, my phone rings, yeah, it's my supervisor. You didn't go out. We promised blah, blah, that you would go out and evaluate. And I'm like, what's to evaluate? The social worker at the hospital is perfectly capable of evaluating
And giving me that information. Yeah.
And she's like, well, we're going to write you up. And I'm like, fine, click. Do it.
Are you guys hearing this?
I was making $28,000 a year, which I looked it up in today's dollars is about, just $48,000, $49,000, $50,000 a year. Like, no.
Right, guys. Right. And when I left community mental health after nearly 9 years in the field, a licensed clinical social worker, I left my job 9 years ago, guys, and started my private practice and was only making $46,000 a year. 9 years ago in the state of Virginia with a license in clinical social work and almost 9 years of in-field practice experience. And that's how much I was making. And it was going to be impossible to make more than that. And I did this on-call work and didn't get paid extra for it. My first job that I was talking to you guys about where I had to help people in the community, that job that I made no money at. So I worked for 2.5 years, Monday through Friday. 8 to 4:30, 8:30 to 4, whatever, 8:30 to 4:30 was my schedule, okay? Somewhere along, there's 6 of us on my mental health skill building team, 6 for this whole agency. We do all of mental health skill building. Management decided somewhere along the way that we needed more coverage. So the 6 of us were now moving to 410 schedule, including a weekend rotation. There are 6 of us. That means every 6th weekend, they were expecting us to work from 8 a.m. to 6 p.m. on Saturday and Sunday, and then take 2 days off during the week. Let me tell you how fucked up all this was. So the questions we had were, the building is pretty much closed except for PACT services, which they do a lot of in-community work for really severely mentally ill people, and they do it 365 days a year. And them and crisis services are the only people in the building on the weekend. This is a 3-story building that employs over 500 people. Okay, nobody there, including our supervisor, but they expect us to come in for 20 hours every 6th weekend with no supervisor, with no protocol on what we do. If we need a supervisor, with no protocol on what we do. If there's a safety issue, with no information on where we park the car and come in and out by ourselves at night, when nobody else is in the building or around in downtown Richmond, Virginia. Also, no pay differential. Also, no explanation on how we would participate in any of our faith communities on the weekend. We had all these questions. My team got together, the 6 of us sat down at a restaurant. We came up with all the things we wanted to ask about. We sat down with our supervisor. I was a spokesperson. Go figure. You guys understand why. But it wasn't just all of the things I was concerned about. It was all the 6 of us. We were presenting it to our supervisor together, but 6 people can't talk at once. Only one can. My supervisor reamed me out and made me cry in this meeting, because we had questions about our safety and everything else. And then she was like, I don't know why you're trying to shoot the messenger. It's like, dude, you're supposed to be advocating for us.
Oh, no.
So we had to, like, this.
That's not her job. Her job is to be the face of the organization. And I so relate with that, because I remember in my job when I had to do that, we worked, evenings, right? Because it's, right. Yes, Allison is correct. It's, and you know what, Allison, you want to hear something funny? So I read this, and I'm going off on a tangent, but I think this is so ironic. I read this historical fiction book about a social worker that I had never even heard of, some social work education that I graduated from, like the number 1 or number 2 social work school in the country. Never even heard of this person. First female cabinet person was the U.S. Department of Labor under Federal Rose, FDR. Her name was Frances Perkins. She was a social worker. She is responsible for Social Security. She got us Social Security. She also apparently, and so there's this historical fiction novel about it, about her life, which I was like, oh my God, this woman. And so I wrote to the author because it was just so moving. And I mean, her husband had mental health issues, and that book, it touched something in me. So anyway, it's called Becoming Madam Secretary, if you're interested in it. So anyway, I was writing to the author. I don't usually write to authors, but I was like, I have to tell you this book, And so we got into this chat, and she said, well, Frances Perkins tried to get national health care for us. And I said, oh, can you tell me about that? Because I had told her what I did and everything. And she said, well, I didn't really research it because it failed. It was her one failure, obviously. And I just didn't have space for it in the book. She said, but what I can tell you is, who shot it down? And I said, no. And she's like, the AMA. American Medical Association shot it down because they were afraid of being controlled by too many regulations. I'd have to look up this, yes, Allison. Yeah. And that's what value-based care, Allison says, procedures are more valued than diagnosis and care. That's what value-based care is supposed to try to do, but because of the way it's funded, it doesn't work because it's capitated, meaning they pay a flat fee per member per month. And if this private for-profit company, whose number one responsibility is to the shareholders, don't ever forget that. And if you do forget that, they're going to sue you like they are with United Healthcare, right? Because United shareholders are suing them because they weren't profitable enough. Okay, so if what's called the PMPM per member per month rate is too low and they exceed it, then Guess what? No profit. Well, that's the essence of value-based care. And guess what? It didn't work in the 90s. So now they've rebranded because it was called capitation or, something else in the 90s. And now they've rebranded it as value-based care. Oh, it's a pretty name now, so it must work, right? And what's the definition of insanity? Please tell me. What's the definition of insanity?
Doing the same thing and expecting a different result.
Bingo. Bingo.
And we're talking decades later, y'all. Decades. And it's not different. And they pay us more than they did decades ago, but not in comparison to where, I can't, like, tell me what you guys think a 15-year veteran attorney makes per hour. Give me a guess.
At least $500 an hour. At least
$500 an hour.
At least.
Insurance pays me $150 or less an hour. And I have
You're making $150 for a social worker. You're doing damn good, actually.
I have, right? We've been over like how I do things. But I have been a practicing provider for 15 years. And nobody would expect somebody. And let me tell you guys, lawyers are the equivalent of master's level social workers. Like that's the education, the licensure, the whatever are pretty equivalent. Like what we have to do, what we have to then prove. You have to get licensed in your state. They have to pass the bar in their state, right? Like all of that. And they make hand over fist, right? And we're barely keeping the lights on. And it's like they have expertise in their area and I have expertise in mine. And it's not to say that healthcare is less important than law care. It's it's the equivalent in different industries, but nobody cares, right?
My take has always been social work is a predominantly female field.
Well, there she said.
And we're working with marginalized communities that, guess what? The 1%, they don't care about marginalized communities, right? Look what's happening in politics right now. Okay, so you've got women caring for people they don't care about. Oh, why should we pay them anything? Right? Women are supposed to be, caring and blah, 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 blah. And I could go on forever, and I know that there's guys who've said this to me, oh, you're just pulling the female card, kind of like, you would say, oh, you'd play the race card. And it's like, no. You got to walk in my shoes. Exactly. Just like I don't know what it's like to be Black.
Right.
You don't know what it's like to be female.
Facts. So back the fuck up with that kind. I will not sit down and be quiet when that is in the room. Time out. If you don't actually know what it's like to walk through this world as a woman, then you cannot say that we're pulling a card on that. It is harder. It is difficult. We are not respected. We are talked down to. I am talked down to within my industry, even though, I have skills and expertise and all kinds of shit. And it's just, oh God, all of it just gets me so angry, right? And so I've given you guys I'm one provider in Virginia, and I've had a slew of bullshit in my 15-year career and my 9 years of taking insurance and private practice, yet I'm still here managing, still profitable a little. It's been hard the last 5 years.
And you know what's really sad? At least a third of my clients are out of network and they still deal with bullshit.
Right, guys?
Out of network. Because you can still be audited out of network. And now there are these new schemes. Have we talked about MultiPlan and Zealous and Data Eyesight?
No. But okay. Zealous can go screw themselves. Having to figure out around that. Oh, my lordy. They take a fee.
Oh, that's just the payment processing part of Zealous.
Your insurance payment from your payout.
Yes. Oh, and by the way, that is strictly illegal, and I have proof. CMS came out with that in March of 2022. I've got documented proof that is illegal, and you know what? Zealous doesn't freaking care, and do you know why they don't care? Because their head of compliance is buddies with people at CMS, and that was proven by ProPublica in August of 2024. They have a whole article about it, and guess what happened? Nothing. Nothing. Although, you know what? There was a bill that went, of course, nowhere. And this just shows the corruption that's on both sides of the aisle. Do you know who one of the sponsors of that bill was? JD freaking Vance even sponsored it to get rid of this zealous, pay to be paid BS. And it still went nowhere. Right? I mean, because, they're all greasing each other's palms. I mean, in my research, I'm constantly finding, investor websites and websites with public disclosures, and they talk about who they give money to politically, right? And they break it down by state, by party, by political candidate, and it's just phenomenal. You take any insurance company, and you will see contributions of the same amount, Democrat, Republican, all the way down. Senators get this much, representatives get this much, governors get this much, state get, blah, 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 blah. And it's just like they're just tossing that money. And then let's not even go with the lobbyists and all that. It's just so corrupt. It's so corrupt. And nothing is going to change as long as that goes into effect. I mean, yeah, okay. I mean, okay, don't get political, Susan. Don't get political. I mean, there's what's going on right now, which is like way extreme. But even when things are quote unquote normal, it's still bad.
It's bad. And that's like, you guys got to understand this. And they want us not to be talking about it. Now, anybody knows me knows I've been talking about it for so fucking long, and talking about the mistreatment that I had as a provider at community services boards. Don't get me talking about those. Those are government funded. Those are locally government funded. And so where the Hanover County, Virginia is definitely corrupt. And the government is. And so it goes from small to large, like they're doing shady shit there too. All to make a buck, right? On public health, like public mental health care. These people have no money. Like they have nothing basically, and they're trying to profit. And it's like, that's why I had 9 years of experience and I'm making $46,000 a year. And oh Lord, right? And
they're not trying to profit. They are profiting. Okay, they are. If you look at all the money that has been estimated in risk adjustment overpayments in the last decade, we could probably have healthcare for all in this country. Just healthcare for all. I mean, it's just taxpayer money, just throwing it at the corporations. That's all it is. It's our money. It's tax money. When they don't want you to talk, that's the time to speak up. You got it. It's like make good trouble. I mean, seriously,
make the wave.
All of that. I mean, I have a list of all of the estimated. And here's the thing. They do these audits, right? Taxpayers fund the audits. Okay, great. It's auditing. And now they just came out this week to say, oh, well, we're going to be more vigorous in our enforcement of audits. That's fine. Okay, Sarah, when you're audited and they prove that your, documentation isn't adequate, what happens?
They take the money back.
Right. When it's United Healthcare and CMS tries to take the money back because they've upcoded, guess what happens? United Healthcare sues the government and the government goes, oh, well, never mind. They haven't collected a single penny on all of these audits since 2007. So what the
because the government doesn't have as much money as big business, and so that would tell you
the government has given it to the big business, and then the big business is giving it back, and then the government is giving it back, and
yep.
What's the point of auditing? It's all for show. It's all to please us. It's like, okay, well, it's not going to do any good unless you take the money back, folks.
Right? Like, okay. And I might pull this up to show it if you got just want to spend a couple of minutes, then we'll wrap up, even though we're over. A thing that I wanted to say earlier. Okay, guys, I'm switching gears a little bit. We're going back to like the big conglomerates, Alma and all of them. Okay, my experience with that back in like 2019-ish, I'd been about 3 or 4 years in practice, and Alma was like new. There weren't as many. I mean, there was Talkspace or whatever the hell the first one was that the swimmer used to, remember the Olympic swimmer that used to like promote that? I forget. There was like one of those, and then Cerebral got shut down real fast in the pandemic for selling client information. And then
Alma was one of the first ones. So Headway was around, I think.
Right. Okay. So Alma is there. an Alma rep reaches out to me to talk about all this. And I'm like, oh, okay, it sounds interesting. I'm listening. Okay. I call them back and we're talking and they're telling me all about it. And I'm a person, guys, that reads every damn word of the contract. Sarah trying to buy a house is at the lawyer's office for a long damn time, because if you've ever bought a house, you know how many documents are there. And I will read every damn word before I sign something and ask questions to make sure that I understand. That is just who I am. I cannot know everything, so I will learn about what I need to know so that I'm not getting fucked over with my money. That includes buying a house, guys, or whatever. And let me tell you, I did almost get fucked over by the loan officer trying to steal from me. Called him out. That was a whole thing. 50-year-old man screaming at me on the phone because I caught him trying to rob me. Whole other story. Again, don't fuck with me, guys, or my money. Like, I am not the one. I am not the one. So I'm having this conversation with this Alma rep. I read through the whole contract, right, that she sent me, and then I'm talking to her. And I'm like, okay, I get it. A lot of that sounds good. I got a question about this part right here. What happens if I leave Alma and I've gotten clients through there? You retain them? And what she said was like, well, we might, da, 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 da. I said, nope, I will not do that. And that was my no. It's like, that was one line in the contract. And she said, well, we might, and it might not. And I was like, no, you're like, I can't retain clients that I get, whether it came through your referral source or not, because I made that distinction. Is it just people you referred to me, or is it anybody come? And it's anybody. And I was just like, oh no. And so that is why I decided not to join Alma or any of those groups, because I would potentially not be able to retain clients that I was seeing through Alma if I then left Alma. So guys, if you started a private practice using Alma or Grow Therapy, and then you decide to leave there, you don't got no business. You don't got no practice.
And here's the thing, I would love to have a lawyer on board, because there have been all kinds of legal developments about non-compete, because that's essentially what this is. It's a non-compete. Right. And there have been all these limitations put on non-compete. How come nobody's going after Alma and Headway and all of these? Because it's in all of theirs that you won't take clients from that were referred by blah, 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 blah. And it's like, first of all, you can't abandon a client unless you want to get freaking sued for malpractice, right?
That's your license, guys. Alma doesn't give a shit.
Exactly. That's against every code of ethics ever. Clients have the right to self-determination. Duh. Doesn't matter. And I mean, we all know that, I mean, yeah, you can say, all right, I won't recruit my client, but I'll let them know where I'm going, and then your client can make up your own mind. All right, great. Now here's what else Alma's counting on. Let's say you're with, pick an insurance company, Aetna, through Alma. Okay, well, that means only with Alma you are with that insurance company. It does not translate over to the private practice. So you want to be with Aetna? Okay, you got a credential and contract, and guess how long that takes? 9 to 12 months. So meanwhile, your client that follows you has to pay out-of-network benefits if they have any, which means higher deductible, higher cost. And that's what these platforms are counting on, because, okay, well, you can leave. You can even, just tell your clients where you're going, and we might, like you said, go after you or not, depending if we feel like it or whatever. But, a lot of clients maybe can't afford to follow you because you're going to be out of network.
And so what that client is going to do is find another provider through Alma or something else to see, even though that you've left. So you built the rapport, right? You did the work, and then you lost the client because you were seeing them under Alma or something else. I'm going to see if this will let me do a screen share for. Okay, I'm going to pull this up real quick.
Oh, there you go. Yeah.
All right, this is the third one you have up here, but guys, I'll put this in the comments for the event when I'm done here, the link to Susan's blogs. And I just want to wrap up with some of these things. I liked what you had here. And the differences here, okay, between billers and credentials, or you, right? Like if you're in this case, the biller and the credential is me, who's also the clinician and the practice owner, or it's somebody like Susan that you hire or whatever else. Okay, so that's different from the telehealth platforms like Alma and all that. And so what she has outlined here is like you, the provider, the biller, you're paying for whatever services you contract for. Me, I contract my CPA to do my taxes. That's literally the only service I pay for. But sometimes you might
also pay for therapy notes, simple practice,
when we get to
whatever
those.
else you're using, things like that. So if you were using a biller, you would pay for the biller to verify benefits, or you would pay for the biller to, follow up on claims, or you would pay on a percent or an hour or whatever. So either way.
Right? You choose the EMR or decide to use paper charts. Parting ways doesn't affect your clinical records. You decide about opting out of Medicare, which Susan already talked about before. And you're typically independent from the insurance company, or the biller is. And
oh yeah, the biller, a third-party biller has no pull with insurance companies, right, unless they've just happened to have been an executive or somebody at an insurance company. But I have no special pull with any insurance company, whatever. People think I do. No, I don't.
Right. And we've already told you guys that these big platforms do, because the insurance company is funding them. It's literally funding them. Like that's what it is.
Yes. And also, if you look at some of the CEOs of some of these companies, some of their backgrounds, they were CEO of this or that insurance company. I found that out this weekend when I was researching this blog.
Oh, the CEOs of like Alma and Grow Therapy used to be insurance company CEOs.
Right. Like I think there was one that was like in Evernorth or something.
Right.
I'll tell you who it is. Somewhere there's I think it was in the first blog, there was, when I was talking about, no, it's not just me asserting that they're going to do this value-based care. They say it themselves. Well,
Exactly.
there was this link to this APA training on value-based care. And one of the presenters was somebody with Alma, and she was formerly head of something at like Evernorth, which is Cigna. And so, it's very incestuous.
They're in cahoots. Yeah. I mean, there's no other way to say it. So the reverse of all those for these big telehealth platforms is you have no say how the platform functions, and you also probably don't know. And that's the bigger issue.
I have heard so many horror stories from clinicians who say that their clients come to them going, the platform charged me this humongous bill and I don't know what to do with it. You won't even, if you work for Alma, you won't even see your clients' bills. If you have a biller, you're going to see what your clients get billed. You have the final say. If you tell me, hey, she can't afford that, let's work out a payment plan. I got to do what you say, right? Because I work for you. I work for Sarah. Okay.
Right.
When you're working for Alma, you're a 1099.
That's right.
You have no say.
That's right.
And Alma isn't even sending these people a bill. They're just charging the credit card on file. And people have gotten hit with hundreds of dollars because guess what? The insurance didn't do what they said they were going to do. How many times have you verified benefits and then the insurance doesn't pay according to the benefits? And they're like, oh, but did you hear the disclaimer? Verification of benefits is not a guarantee of payment. It's true of Alma too, folks.
Right.
And then when their billing catches up and they realize that the person has a deductible or whatever, they're just hitting your credit card.
Right.
And the therapist is powerless to do anything about it.
And again, guys, like that doesn't look good for you, because if they come back, if anybody ever comes back and does a lawsuit of any kind, and they're going to say that you did balance billing because you were the provider that billed, even though Alma billed, right? Like, so if you don't know what's happening there, you're potentially putting your license at risk. Like, I don't know how else to say it. This is what I said to my friends around here, and they were like, oh, well, this makes it easy for me. And I was like, you literally could just like, this company does not care about you. Like they care about making money. They don't care about the patients that you see. They don't care about you. Right. And Susan already told us what it is to opt out of Medicare, and that it's absolutely a conflict of interest that the insurance companies are investors. And and you guys, like, you need to understand this. And I get it. It's not easy out there. I've been a mental health provider direct
No.
service provider for 15 years. Sometimes I can't even describe how tired I am of doing direct service work, which is why I'm also trying to get into other things and help other people like do it. So like, you know, if I cut down my caseload a little bit, but I help another therapist, like I have one, then, you know, we're kind of spreading the wealth here. And let me also say, I've never worked for a group practice. I've done everything myself. I credentialed myself. I got registered with the state corporation commission, got my business license, everything, guys, everything. I've done everything myself, 9 years, no lawsuits. I've had some insurance issues, but no major clawbacks because I fight for my money and I have gotten it. I haven't had any major loss of revenue for client refusal to pay. Have I lost some dollars? Yes. Sometimes that credit card doesn't go through and you don't get that late cancellation fee and you just eat it. But I have not had that happen very much because I run a good, sound business as well as provide good patient care. And so if you want to do that yourself, you want to come talk to me. I never had a business class, not a business degree. I never hired a business coach. I never hired a business attorney. Not 9 years of running a business, guys. I still have never done that. I turn over a profit every year. I don't have any sanctions on my license complaints ever. I've seen thousands of clients at this point in my career because I worked in public mental health and they just churned them right through. And so I can actually help you do this. The stuff I'm not as good at, Susan can help you do. I mean, I did it. It's going to take you a little bit longer if I walk you through it, but Susan's going to be able to walk you through the credentialing part if you want to do that, or if you run into billing issues. You can hire when you have an issue and not use her when you don't have an issue, and I can teach you how to do it yourself because I do it all myself, and nobody taught me. I self-taught and read shit, and figured it out.
You know what's funny, Sarah, is there are a lot of billing programs out there that will sell you how to bill, and it'll be thousands of dollars. Okay. I charge $150 an hour. Okay. Which is about, reasonable for a social worker. I mean, I may go up a little bit for inflation, but give you a discount on the back end if you, buy a package or whatever. I mean, I may go up. It wouldn't be more than, I don't know, I'm 65 or whatever. Anyway, I have taught people the basics of billing 3 hours. So 150, that's what, $450? Okay, not thousands. It doesn't take you. Yeah, I mean, I've had clinicians go, "Oh, should I go to billing and coding school?" I'm like, "Well, you can if you want to, but you don't need to." And billing and coding school is like $20,000. Okay,
and you don't
definitely don't need to do that. And you definitely, there are these courses out there. You can take them if you want. I mean, Rescue Biller is not going to cost very much money. It's going to cost to get.
That would have made it so easy for me.
Right.
Instead, I had to piece it together and learn it myself, but you've compiled it and put it in one spot. It would have been so easy.
Wikipedia of rules. How much do you think it would cost? I don't know if you could allow me to screen share. I'll show you what it is.
If you can screen share, go ahead.
Yeah. How do I screen share?
Do you see a little thing at the bottom that has a little arrow on it?
Do I have to? I'm on full screen. Do I have to disable full screen? Let's try that.
I don't know.
Arrow. No. Oh, yeah. All right. Okay.
While she's pulling that up, guys, let me also say, I will help you so you can consult with her about billing, and I will help you start your practice. It will cost you a few thousand startup, but not ongoing. And then you own your practice, all of it. I literally teach you how to do it all yourself, to be your own entity. And after you work with me in one of my packages for either 4 weeks, 8 weeks, or 12 weeks, you're done with me unless you want to hire me for something else, right? And that's do you have a question later? Do you have a business question later? Do you have a client issue later? Whatever. But once you've done, let's say you did my 12-week package, which is a full end-to-end startup of a private practice, you won't need me anymore. I'm not ongoing collecting from you. I'm not taking a percentage of what you make. I'm literally helping you start your own business and then sending you off. And then you can choose, like Susan was saying before, what contracts you have, right? What services you use, how much you pay for EHR, if you hire anybody or consult with anybody to help you down the line, or, you look for as many free resources as possible. And let me tell you, if you start your private practice up with me and you invest a few $1,000s in yourself, in your business, for me to teach you everything I have learned in the last 9-10 years about doing it, I will show you again, guys. The only person I pay to do anything for me is a CPA. That means I do my website myself, my billing myself, my notes myself. I do it all myself. I will teach you how to do it for the lowest overhead possible to maximize your profit and to only pay for things that you absolutely have to pay for. I will help you find free information, resources, tell you the things that like I don't think are worth paying for because there's no return on it. I will give you all of my insider information and then send you on your beautiful way to serve 5 clients a week or 25 clients a week or whatever works for you with using health insurance and knowing how to bill and get reimbursed. I'm not a self-pay practice, guys. I have not been for 9 years. And it is totally possible. And you don't, and let me also say something else about the services I provide. I'm a trauma-informed professional, meaning I run my business via trauma-informed leadership and trauma-informed care. That is not the same as working with a business coach or an attorney. I'm going to tell you right now, because I'm a mental health provider and I'm also you. And I also understand that we have all been disenfranchised and marginalized and abused in our service roles. And so I'm not going to do that. That's why there's not ongoing payment. That's why it's transparent and clear with what you get. And if you want me after that, I'm here to support you. And that's how that's going to work. And it's the same with something like Susan. It's like, we're not trying to gouge you to make money. We're trying to help you so that we can actually bolster
Let me ask you, Sarah, how much do you think something like this would be worth?
What, me?
Yeah. If you were a private practitioner, how much would you expect to pay for something like this?
To pay for something that you have there? Is that what you're saying?
Yeah, per month. Just how much would you expect to pay?
Oh shit. $350 a month?
God, I wish I could charge that. $100 a month. That's all it's going to be.
How much?
100 to get all this. This has cost me hours, and it's updated every day, every single day. Now,
yeah, and that's great, guys. This is like old stuff I've had to learn, like piecemeal and put together over 9 years.
Now,
and Susan has compiled it for you.
With this $100, of course, you get discounted rates on consultation with me.
Nice.
Discounted rates with my store. We're going to have internal events with experts in related fields, like I've got a nurse practitioner colleague that talks about documentation, or like I'm talking a lot with Beth Rontel, the documentation wizard. Like, we're going to collaborate and have an affiliate marketplace. We're going to do all sorts of really good things. There's billers here. And I'm vetting people. I'm not just letting any old biller who wants to, sign up. It's the biller has to prove that they know what they're talking about or are willing to learn. Okay. And so it's a community, and we have a private Facebook group. It's a community of support with clinicians, because we are all on the same side against these bazillionaires. Okay. And so I'm not here to, take lots of money either. And, for group practices, big group practices, of course you need a biller. Okay. Of course you need a sophisticated system, but if you're small or if you're 2 people, you can so do it on your own.
Yes.
And some people find it worth their while to they do it on their own, and they just schedule with me once a month for an hour, and they pay the consultation rate, and they go, it's like clinical. Think about it like clinical supervision, only it's supervision for billing. Yes. Oh, I have this case. I don't know what to do with it. Okay. And I tell them what to do. Yes. Why did this reject? Why did this? And then if somebody has to call the insurance company and you don't have time, I'll do it.
Right. Exactly.
Right. Okay. Yes. And, billers, and believe me, I do not want to undercut my billing colleagues, but there's a reason billers charge 8, 9, 10% and still aren't making it. And that was in that first blog. But you know what? Do you really need to pay 8% on a claim that you hit submit and never touch again? You don't. But the reason the billers do that is because the hard claims are balanced out by the easy claims. Right. Well, Alma and everybody is destabilizing that because they're taking the easy claims away. Okay. And I understand why therapists feel like they have to do it. I mean, Credentialing is fast. And in some markets in this country, especially in California, you can't get onto a platform unless you go through, you can't get onto, let's say, Anthem Blue Cross unless you go through Headway or whatever. It's become exclusive. You have to do it through the platform. So people feel like they don't have a choice, especially if they're new, you know?
And you do. You do have a choice.
You do have a choice, and you can advocate, and I can help you get on without freaking Headway. The only problem is it's going to take you longer. And so I understand, and there's no judgment. Okay. I understand why people do it, but I work with a lot of people who they get on, they immediately see what a blah, 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 blah it is. I'm trying to not do the 4-letter words here. And then they contact me and I help them get off, you know? But so that's it. That's what it is. That's the model. And, and then if you still feel like you need a biller because you're not Sarah and you're not a numbers person and you want to see a couple of extra, clients to pay for your biller, I can hopefully connect you with somebody who's ethical and knows what they're talking about. Because unfortunately, there are a lot of billers who, they don't know very much. And I don't want to be judgmental because I started this, I thought I knew a lot and I knew nothing, but the more I did it, the more I learned. But, I've had billers look at this and go, oh, well, yeah, I guess I should, but no, it's too expensive. No, I don't need to train. And then they're telling me things like, oh, well, you can't look up an out-of-state Blue Cross on Availity. Fuck yeah, you can. And the biller is like, really? And I'm like, yeah.
Yes, right.
And she's like, well, show me. I'm like, sign up. Oh, well, I shouldn't have to pay for that. Okay, figure it out on your own.
Exactly. Okay, so let me tell you guys, Sarah figured it out on her own in the last 9 years, and other people choose to have Susan teach them so they don't have to figure it out on their own. But let us just say, Susan, will you stop your screen share so we get...
Oh, sorry. How do I do that?
I have no idea. Does it say at the bottom?
How do I do that? Remove source?
Maybe.
Oh,
there you go. There you go.
Sorry.
Awesome.
Yeah, one of the things I'm not is like
extremely
technical.
Okay. I don't think I've ever had anybody try to screen share, so you're testing it out for me too. So guys, here's what we're saying. Like we want to help clinicians be successful. I personally have a heart for people not burning out doing clinical work, but still doing good clinical work. The wellness coaching industry is diluting our field and they are charging things like $300 an hour to your $150 or less that you are making when you have more credentials and more experience. It's ridiculous, but allow people that have been in the field, that want to promote the field, that want to elevate the field, help you stay in it, be successful, make money, not burn out, and actually help people and not give these fuckers more money because they don't need it. Okay. So there is support for you, but I mean, you got to invest in yourself some. There's not going to be no cost and there's not going to be no work, which is like pretty much what you're getting at Alma, but you're also getting a whole slew of consequences and things you don't know. And I value the same thing that Susan values in educating you. I'm not going to keep anything from you. Like once you pay to work with me, if you have a question, I'm going to answer it. If you hire me on one of my consulting packages to start up your practice, I'm going to educate you and teach you as much as I know for you to be successful. Everything that I have learned in the last 9 years on how to do this myself, I'm going to teach you. So then, like I said, at the end of that time, you don't need me anymore unless you want to consult on something else, right? You have a difficult clinical case, you have a business question that you don't understand, et cetera, et cetera. It's the same reason that you would hire Susan for a consulting hour to say, I don't understand why this got denied. What do I do to appeal it or whatever? And so not only does she do it so you do it right, she teaches you what to do and what to look for. So then maybe next time you can do it yourself. Literally, as always with this field, we work ourselves out of a job, but that's the only way that we're going to elevate people and build credibility that we are actually trying to help people. So
I don't know about you, but I'm not worried about being unemployed anytime soon.
Right? Me neither. And that's the thing, guys. Okay, let me say something else, and then we wrap up, and I'll let Susan say some final words and anything else she has going on. Let me also say that the Interstate Compact is coming for social workers, for therapists of all kinds. It's coming. I don't know how. It's not going to be long now. I think there's at least like 30, 35 states that have signed the Interstate Compact. Yep, it's a lot now. So when the interstate compact, and this is for social work because I follow social work stuff, the interstate compact, when it goes into effect, means that all the states that are participating in the interstate compact, that you are going to have the ability to practice. Okay, so that means you're going to have the ability to provide therapy services in whatever states contribute to this interstate compact if you choose to opt into the interstate compact. And they may do it by region, but that will give you more states than the one you're licensed in now without having to license in 5 or 6 or 7 states. That means if you have a virtual based practice like me, even though I had an in-person based practice before the pandemic, I can help you start up either one. But if you have a virtual based practice, that means when the interstate compact goes in, your client base is going to be huge. You have
well, let me interject some reality. You're right, Sarah, but what you can expect also is that Alma and Headway and whatever are going to say, we'll make it easier for you to take insurance because for every state that you do business in on the insurance side, you have to have a contract, right? Okay. And I have worked with a lot of people who've made state to state moves or gotten licensed in 2 states, and they've made predictable mistakes and claw back. And I hate having to tell somebody, oh, why didn't you do, or, did you think about, and they're like, no, I didn't think about it. And, because guess what? When you call the insurance company, they're not going to tell you because they don't freaking know. I mean, seriously, they don't freaking know. If you call and say, well, I'm moving from Virginia to California, which are, by the way, both Anthem states, they're not going to tell Sarah that she has to get a California, contract with Anthem. They're not going to tell her that. And then,
she bill and not pay for it.
Right. And then she tries to bill through Virginia when she's in California. Nah.
Right.
And then, because you know what? It's easier for them not to tell her because then they can deny claims legally.
Right. So these, right. Okay. Well, that's another reason you're going to need to know, Susan, when the interstate compact goes into effect, right? The idea is, though, like Susan's saying and I'm saying, you're going to have a business. I don't know what else to say. That's the best thing I can say. If you are a licensed mental health provider, starting your own practice is a ready-made profitable business because so many people, and if you take insurance, you'll be full in no time. I
just have to know how to do it.
You just have to know how to do it so that you are getting paid. But if you are doing it correctly and you are not having like huge headache, I don't know, ethical or business things, like I do not have those, and I will teach you how to not have those, then you can actually do this, from day one in my private practice now, besides like the first 6 months of the pandemic, which was just a shit show. I saw way too many clients a week, but I really haven't gone outside of like 26 to 28 clients a week in my private practice. And I've made more than triple my last community services job. And I'm not lying, guys. And it's just me. I don't have staff. I don't have anybody paying me extra. This is me seeing clients, and I only get paid when I see clients, and I'm still able to do that. And like, before I started my other business, a bunch of other stuff to do, I wasn't even working 40 hours a week and was still managing to do it. Now, insurance doesn't pay us a lot, but man, it's more than I was making in community services board and other agencies. And so it's totally possible. It's totally doable. Get with the people who know what they're doing. Get with the people in your field who know what they're doing and can speak your language, and then learn how to do it for yourself so that you're not losing out on dollars and information that you need to like run a practice and be ethical and not lose your license.
Let me tell you the 2 biggest mistakes, and we'll leave with that. The 2 biggest mistakes that people make in private practice, and they're expensive ones, is number 1, credentialing errors lead to claims errors, and you don't credential correctly, you're going to have claims errors, and I can't fix them until we fix the credentialing. That's number 1. Number 2 is understanding that quote unquote billing is more than just hitting submit on a claim. It is the whole package of what billers call revenue cycle management. That's like the fancy term. And it's a long list of things, but you can develop systems to automate as much as possible. I'm a big believer in you got to get good software. And a lot of consultations that I do are about helping a practice find their ideal platform, because not all platforms are created equal. Some platforms are better for some things than others.
That's right.
For instance, I know a lot of people like simple practice, but if you're going to have a Medicare-based practice, you don't want to take it because it doesn't handle Medicare as well as some of the others. Now, it's great if you're going to be out of network and you're going to do super bills and you're going to do auto charging people. It is the best, the best. But see, every platform has its tweaks, you know, and then there's all the EMRs, what you prefer on the clinical side. But I can tell you about the billing side and what's good, why, and the cheapest isn't necessarily the best.
That's right.
Okay. But automate, 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 automate.
That's right. And that's what I've done.
And I teach people, and you don't need to be a tech person. I'm not a tech person.
I started on paper 9 years ago,
right,
and now I've automated so much through my EHR.
Right. Right. And it's learning the systems, and it starts with getting good information when the client calls you. Yep. You got to get all the information. And I do mean all, because there's a reason. And what you don't ask will trip you up every single time. And it goes from there. It's verification of benefits. It's submitting the claims correctly. It's following up. It's just the whole shebang. And I can teach people to set up those systems. And what I find in practices that are losing money is they have no systems, just none. You know, they may be using the great EMRs, but they don't know how to use them. And I'm like, oh, what if you did, and they're like, I never knew you could do that.
Right. Guys, like,
because you're not a biller, you know, so it's like, I will teach you how to do that. Then you do it yourself. You only pay me for the 1 hour or 2 hours that you're with me, and that's it. And then you got a problem, 6 months later, pick up the phone. I'll be here, you know.
These are learnable skills that can be taught to you by people who are seasoned and know what we're doing and have been successful.
It's really empowering. It's really empowering. I have seen so many people grow in confidence. They come to me, they're afraid, they're intimidated. And it's like, you don't have to be afraid of this.
Right. And
they're like, oh, but what if I commit fraud? I won't let you commit fraud.
And dude, they're committing so much fraud.
Well, you know, but you know what? They'll go after you in a heartbeat because you're easy, but they'll let United Healthcare do it because of, well, we've already talked about that. But I won't let you commit fraud.
And people are afraid of that often. And it's like, no. And the same with like ethical practice and running a business, all the things you need, I will help you. I know what those are, right? I know how to steer clear of this. How do you manage like a client who's upset about this or that? I've done this for a long time, guys, and been successful. Susan runs a business. I run a business. So not only do we help the people that we help, but like we're successful in running our businesses. And that's what you want to know, because it's not providing patient care or just the billing correctly side part to make money. You have to run the business well. And these are things that you can be taught.
And you know what? For women who went to school to be social workers, mental health counselors, even psychologists, I don't know about you, Sarah, but I had 0 business classes in grad school. Zero. It was just not important. They didn't think about it. The professors were in the ivory tower. Oh, you know, you don't need to be a business person. And it's like, we have to get rid of that mindset.
Yep.
You are a small business person.
Yep.
Exactly. If you don't have that mindset, and it isn't ugly, it isn't dirty, it's if you don't get paid, you're out of business. And then who are you going to help?
Then who are you going to help? Exactly. Right. So it's wearing both hats, which I have successfully navigated for 9 years, being clinician who answers all of my client emails, even the angry ones, because I don't have staff, and all the billing issues and all of their pissed off comments about my late cancellation and no-show fees, and then show up and be their clinician on Tuesday. And I navigate both and have for a long time. So contact Susan, contact me. This was great, Susan. I appreciate all your information.
Oh, fun, Sarah. It's always so much fun.
I know. I really appreciate you taking the time. And this is a long one, guys, but there's a lot of good information here.
Yeah, I thought we were going to be for an hour, and here it is too. But, you know, I've enjoyed every minute of it. It's fun. Yeah.
I appreciate you. And you've taught me so much, and everybody else so much. So guys, look her up too, and look for her blogs. And I don't know what we're talking about next week, but I'll let you guys know soon. Thanks.
Do I just close my web browser? How do I?
Yep, I'm gonna close it, and then we'll be good to go. We'll see you guys next
week. All right.
week.
Talk to you later, Sarah.
Bye.
All right. Bye-bye.